Hello, my name is Lilia, and today I'm going to be instructing you on how to take blood pressure from a patient. First, you need to gather the necessary materials, which include the sphygmometer, which has the blood pressure cuff and the handheld device. You will also be needing a stethoscope. On the blood pressure cuff, there is a diagram on the front indicating the different sizes for different patients. There is also a line indicating where you should match up the blood pressure cuff with the individual's brachial artery. On the back of the handheld device, there is a clip that is used to release the air pressure and control it during the time that you are taking the individual's blood pressure. When inflating the blood pressure cuff, you want to pump the bulb quickly, inflating the cuff about 20 millimeters of mercury above systolic pressure. This is usually approximately 180 to 220 millimeters of mercury. Then you want to slowly release the pressure at a rate of about 2 to 5 millimeters of mercury per second. On the stethoscope, you have two parts that you will be using during the blood pressure measurement. You have the ear tips and you have the diaphragm of the stethoscope. This is the part that will be placed on the brachial artery of the patient while measuring blood pressure. On the inside of the blood pressure cuff, there is a line indicating whether the blood pressure cuff is too small or too large for a patient. And again, you do have the line indicating where you should align the brachial artery on the blood pressure cuff. When putting the blood pressure cuff onto the patient, you want to make sure that it is aligned with the brachial artery and that it encircles the patient's arm approximately 80%. Prior to placing the stethoscope ear tips into your ears, you want to make sure that they are facing away from the body. Prior to taking the patient's blood pressure, you want to make sure that the patient's feet are flat on the ground and that the arm is supported and that the patient has good posture. Make sure that the patient has been sitting for approximately 5 minutes prior to taking blood pressure. Place the diaphragm on the brachial artery and quickly inflate the cuff. When releasing the pressure from the blood pressure cuff, you want to note the systolic blood pressure, which is the first of 2 or more Korotkov sounds. You also want to note the diastolic blood pressure, which is the point before the disappearance of the Korotkov sound. After taking blood pressure and noting it down, provide the patient with blood pressure measurements in both writing and verbally. After taking the patient's blood pressure measurement twice with a minimum of 1 minute apart, you can then take the average of the two blood pressures and classify the patient into normal, prehypertensive, stage 1 hypertension, and stage 2 hypertension based off of this chart. Then, once classified, you can encourage the patient to make lifestyle modifications if necessary and monitor their blood pressure regularly.